Our next speaker, Greg Midgette, is going to talk on losing your license to drink, a new approach to reducing problem alcohol use.
Thank you very much. Thank you. It's great to be here. I'm presenting something that is a public safety intervention that has public health consequences. Does anybody have any idea what in the U.S. every year the social costs are of problem alcohol use? Ballpark? 200 billion is a really good guess. On the order of a $250 billion, according to the CDC. So it's very expensive. When we think about the expense of different types of drugs, in the U.S. at least, alcohol is the most expensive from the social perspective. And about a third of those costs are from criminal justice, so adjudication, incarceration. The remainder are medical costs and public health costs. So it's extremely expensive, and having just a small difference, a marginal change in heavy use can have big effects. And the Pareto rule seems to hold here too, where about 20% of drinkers drink about 80% of alcohol. So there's a core set of people who are really heavy drinkers, and a lot of them show up in the criminal justice system. And so in the U.S., the idea is that, and for a lot of places, the idea is that you have some minimum age for drinking. And when you pass that age threshold, you become 21 in the U.S., you're allowed to consume and buy as much alcohol as you want. And that goes unregulated. And so either you're incarcerated for something relating to alcohol or for some other reason, or until you go into a inpatient treatment setting where your alcohol consumption is eliminated.
Or die in a car accident.
Or if you die in a car accident. Or, yeah. An alternative is to say, well, what if you thought of this license to drink as revocable? What if you suspend or revoke it? And that's the core principle of this program that I'm going to present. It's actually from South Dakota, called the 24/7 Sobriety Program. And so South Dakota was among the nation's worst states in terms of alcohol-related fatalities, both from traffic accidents and from clinical causes. Judge Larry Long, who was at the time an attorney, he was the Attorney General of the state, but was from Bennett County, a small, very rural, even in terms of South Dakota where everything's pretty rural, county. And he saw a lot of the same people showing up in court and then going to jail and eventually prison for alcohol-related crimes. And he said if these people weren't drunk, they couldn't drive drunk. So let's keep them from getting drunk. So in lieu of very harsh sentences that exist in South Dakota, for example, a third DUI offense is a felony. It carries up to 2 years in prison. The second DUI offense can carry up to a year. Normally it's 40 days served. So it's a huge disruption for a second offense. So it's very punitive. In lieu of that, test people every day. Keep them out of jail as long as they don't show up drunk, as long as they give them a breathalyzer in the morning, in the afternoon, or in the evening. As long as they don't show up drunk, and they do show up, they live their lives as normal, and they pay $1 per day for that test to pay for the straw and the facility costs. They tried out that program as a pilot in 3 counties in 2005. Anecdotally, it seemed to work really well, and judges got on board. At first, they were really suspect of it. They didn't think it would work. But judges and sheriffs got on board, and it ends up that the program spread like wildfire through the state. And so at first it was from anecdotal evidence that 99% of those tests that were being administered twice per day to these people who were problem drinkers were coming back clean. And then by 2007, the program had rolled out to about half of the counties and about 80% of the population of the state. And then it was funded to go statewide by the state. And again, it's operating at the county level. So by 2010, the state was saturated. The one missing county is a population of about 6,000 people, and it's about the size of Santa Barbara County. So it's not missing a whole lot, but missing that one county. So through December 2013, at the end of our data from our analysis, there were 25,000 people that were enrolled in the program, about 80% men. All of them had at least 2 arrests related to alcohol, typically DUI offense. Everybody blew twice per day into those breathalyzer tests. 99.7% of them came back clean. When people violated, they went to jail, but only for 12 hours or 24 hours. If they kept failing, then the consequences would get worse. But they were brief, not in the scheme, especially in South Dakota, of punitive programs. This wasn't all that harsh. So it seems harsh when you hear about it initially. Altogether, they produced 4.3 million days among those 25,000 people of not finding anybody to drink. It ends up that about half of people fail at least once, but only about 20% fail twice, 10% fail 3 times, and almost nobody fails 4 times, which is remarkable. And the people are on typically for about 3 months. So we looked at that looks great, but what are the consequences? It seems like this could be a very effective program. So the team that I was part of it ran evaluated the community level, so the county level effects of the program. And I won't get into the unless you really are interested. It looks like some of my transcripts fell apart. But if you have questions on the modeling methodology, we can talk about that. What we looked at was the effect on the count of repeat DUI offenses, domestic violence offenses, and traffic accidents of imposing this program, this 24/7 sobriety program in the county. And being that the program rolled out slowly over time across the state, we could exploit that with our methods and use a difference in differences model. So we're looking at when 24/7 clicks on in a county, when they start using it, does it reduce drunk driving? Does it reduce domestic violence? And so we use lots of interesting controls, including whether school was in session at the time. Since South Dakota universities, there are 3 large and 1 moderately large universities that shipped about 80,000 people, so 10% of the population, in a way bigger proportion of the problem drinking population, college-age kids, throughout the state. So we account for that in the model. We account for the Sturgis Motorcycle Rally, which, if you're not aware, is about 800,000 person week-long bacchanal in the Black Hills of South Dakota, where there's lots of drunk driving. So we account for those things in our model. And we find about a 12% reduction in community-level effects, community-level arrests in South Dakota. That's not just individuals. That's not just people on the program. And more interesting than that, we find a 9% reduction in domestic violence, which wasn't even initially targeted. And that's the thing that's really interesting about the program. You keep people from drinking in excess, there could be lots of good spillover effects. And this is just a program without a treatment component. So there might be added value to having brief interventions or having some sort of structured treatment, because the program doesn't work for everybody. There are the people that fail 3 times. There are the people that reoffend while they're being monitored. But for a lot of people, it seems effective, at least while they're being tested. And finally, we saw some evidence of traffic crashes with a reduction in traffic crashes among males 18 to 40, so that core problem drinker cohort. The next thing, so this is community level effects, looks great. If we test different thresholds for what we count as the program being active, we can find even bigger effects. So these are relatively conservative effects that we're reporting here. And if you have more, if you're interested, this study was published in the American Journal of Public Health in January of 2013. We have another that we're about to submit looking at the individual level effects. So people who are on 24/7, this program, for DUI 2 arrests or DUI 3 arrests, their time to their next arrest, compared to people who arrest for DUI 2 or DUI 3 who are not exposed to 24/7 this program. That's just testing and moderate or fair consequences. I plot two sets of survival curves up here. A higher curve means better, means that people are less likely to recidivate, to be rearrested. And in both cases, the dotted lines, the 24/7 program, outperforms the comparison group. This is including all sorts of, here we're not including all sorts of controls, but when we do, again, we don't need to go into the methods unless you want to. I'll hopefully have time for questions, but we'll see. When we account for differences between the 2 groups using something called a Bivariate probit model, which accounts for selection issue, if there's things that we observe about people and we can account for them statistically, like their past criminal histories, but there might be other characteristics that that lead to selection into the program that we don't observe. And so we use this model as a way to account for those unobservables in a way, using what's called an instrumental variable. So even using all of those fancy controls, we still see the program is effective. And it's even more effective for DUI-3, who you might think are the more problematic or the more resistant to change population. We see about at the 6-month mark, so 6 months after an arrest, there's a 70+% reduction in rearrest. And these are preliminary numbers, but they're pretty close to final. The complementary measure for DUI-2 is a 44% reduction. And then we see that the reduction, or these effect sizes taper as time goes on. And that kind of makes sense because the further you are from the stimulus, the less powerful it is. Thank you. So that's really promising. But is it a case where South Dakota kind of captured lightning in a bottle? Is there something unique about South Dakota, or can this work elsewhere? So we received additional funding from NIAAA, the National Institute of Alcohol Abuse and Alcoholism, to evaluate the program in North Dakota. And then also, we finished up and so that's ongoing. We finished up another short project looking at the program that was replicated in Montana. Again, these are states that are very similar to South Dakota in a lot of ways, especially in terms of demographics and being big and square and having roads that go in straight lines for hundreds of miles. But we see the program still works in Montana in about the same way, even though fidelity might be a little different from location to location, because it's run there's 60-ish programs in 60-ish counties that run the program in South Dakota, another 40 that run in Montana, and they all run a tiny bit differently. Sometimes you blow into the breathalyzer through bulletproof glass in the back of the jail facility. Other times, another place, they converted a Kia dealership that went out of business into a testing facility. In both situations, it seems like it works. But we need to learn more about that. But we still see that 40 to 60% reduction at the 1-year mark and at the 3-year mark. So well after the program is being monitored. Or well after people are being monitored as part of the program. So, cool, it works in the big square states. Will it work in a city? So Jacksonville, Florida is now in a pilot phase of this program. Jacksonville has a population of about 850,000 people, which is about the population of South Dakota, and is about the size of a single county in South Dakota. So it's a real city, a big city. But so far they've only got 40 people on the program. It hasn't even been running for a year yet, but they're still seeing that 99+ positive or plus clean test rate. 99% of tests come back clean. And they're testing across 3 locations, and eventually they're going to go citywide with it, and hopefully statewide, and we're evaluating that. We're hoping to evaluate that in the coming years. So then there's the question of cost, which often gets ignored, but here it's central, especially for states that are really budget strapped. I mentioned before that people paid, as part of the program, $1 per straw. The straws cost 10 cents, 8 to 10 cents. So the counties collect that as revenue. And that revenue ends up paying for the program by fiscal costs alone. So that might not work everywhere as a matter of public policy. You might not be able to charge people in other locations, but in South Dakota, the fiscal costs are paid for by the program participants. And the participants don't face the heavy legal fees that are associated with repeat DUI offenses, and they don't face the possibility, or they're much less likely to face the possibility of rearrest and potentially death. We also have a paper that's we just revised and resubmitted to JAMA Psychiatry, looking at the mortality effects of 24/7 in Montana, in South Dakota, rather. And it seems like there might be some effect, especially for circulatory causes and all cause, which captures traffic accidents. And we're excited if and when that gets published to share that. So it ends up that this program is cost effective and can be used in a lot of different settings potentially. There are things we still don't know. So we'd like to have, again, this is a natural experiment that we studied. So it's not an RCT. We'd like to to try out the RCT, see as much as we can, set up a good control, figure out whether treatment has a role. I'd like to know about the effects on participants and their families of not having drinking, and find out whether implementation matters. So thank you so much for your time.
Fascinating results. Excellent job. Great. Questions? Shazi, you want to do that?
Here in California, they have a program called drug court,
Mm-hmm.
where people go to court and check.
Yeah.
Is that similar to this?
The big difference here is that oftentimes there aren't. So in South Dakota, in these 24/7 programs, if you test and you fail, you immediately face a consequence. So there's three prongs in criminal justice theory. There's three prongs to getting people to change their behavior. There's the immediacy of the consequences, the certainty of the consequences, and the severity. And so 24/7. So in the case of drug courts, which can be really effective, and there hasn't been a whole lot of systematic evidence to compare drug courts to 24/7 because they're kind of different things. Drug courts typically don't send people to jail immediately when they fail a test. This is a pretty heavy-handed, punitive program in that if you fail, you face consequences. So it's different in that respect. And you don't have face-to-face contact with the judge like you do in drug courts either. So it's a different thing.
I'm like so still thinking what that is county that was not.
Yeah.
What was the reason?
So a lot of so in order to get the program to run, you need to have a judge on board, you need to have the sheriff on board, you need to have a testing facility. South Dakota has done a remarkably good job kind of lobbying to these local officials to say, hey, get on board, this thing's going to work. But they haven't done a perfectly good job. So it's just one case where they haven't gotten it.
Say again how long the program runs for, and you had those in Jacksonville. It got better with time. It looked like.
Yeah. So some of that is the modeling methodology. Yeah. So we got to look deeper into that. So it'll fit a line, and we'll talk about a lot of those experience later on. But the program typically, and it depends on the offense. If you're on for a DUI too, it's typically about 3 months. So your second DUI, if you're on for an assault charge, or if you have a long criminal history involving alcohol, you might be on for over a year.
And then it stops.
And then it stops.
Why would we do? Why don't you just keep it? Just too much costly, or the people don't want to do it anymore, or?
That's a great question. Yeah.
What? Okay.
It makes it really inconvenient for cohorts. So there's the location. Oh, this is a good thing. That's a great question. Central location for the PBT test. The other alternative is to wear a scram bracelet, which I forgot to mention. It's a really important thing. So a scram bracelet, scram is a name brand like Band-Aid, but it's a transdermal alcohol device. And it picks up alcohol sensor, it picks up sweat. Alcohol concentration in your sweat every third half hour. And it can differentiate whether you sprayed cologne on your ankle for whatever reason versus had a couple beers. And so it can't catch whether if you slowly sip the beer through the day, but that doesn't make you drunk, so that's okay. Just like a breathalyzer test, if you had a beer after you tested and then you wait 12 hours, that beer won't show up in your system either. But the scram bracelets, to get back to your question, are an opportunity to have people be monitored away from that facility. It's more expensive.
Great question.
Are you aware of that many of the providing, the participating providers are actually participating in the drug control program?
In the what?
The drug control program, which is now partial shot to get intravenously once a month.
No, these are all run at jail facilities. And if someone was also and give some sort of medication.
Want a handful? Our next speaker is Dr. V. Emily Hartwell, talking on genetic and environmental determinants of substance abuse. Thank you, Emily.
such a pleasure to be here with you all this morning. I'd like to thank Dr. Friedman for inviting me and excited to share some of our work that's ongoing at UCLA. And I have no conflict of interest to disclose.